Okay, so hi everyone. Welcome to the SMA EMR team's Digital Health Checkup webinar series. This is an ongoing series that takes place every month, and each time we have a presenter discussing an aspect of healthcare in the digital world. So my name is Andrew Strang. I'm a team lead with the SMA EMR team. I'm going to introduce our presenter in a second, and then I'll facilitate any questions you might want to ask. Today's topic is Fluency Direct, self-dictation and the EMR. And in this session, we're going to be talking about the use of Fluency Direct in the context of a Curo. We're lucky to have Dr. Jeffrey Wilkinson presenting this session. Dr. Wilkinson has used dictation since the beginning of this practice, and he's been an outpatient cardiologist in Moose Jaw for the last 3 years. So without further ado, I'll let him take it away.
All right, well, good afternoon. As Andrew mentioned, my name is Jeff Wilkinson, and I am a cardiologist, and I am predominantly an outpatient cardiologist. And I am really happy to be presenting this topic for you today because I've been working fairly closely with the SMA about the use of dictation in clinical practice. And so the SMA has been promoting a new program which helps us get access to dictation services. And I am a huge fan of it. I think it's a wonderful program. And I am very excited to tell you about how I use dictation in my clinical practice. And maybe there are some ideas or some takeaways that you can take from this talk today to use in your clinical practice. So just to give you a bit of a background, I was in residency 3 or 4 years ago. And as a resident, the staff people that we worked for were very fussy about their notes being done right then and there. So when I finished seeing a patient, I would go to the telephone in the hospital and I would go dictate after every single patient. And so when I entered clinical practice, I thought to myself, why not just keep doing that? I like having my paperwork done immediately after I see the patient, and I think that that's great. I actually, in my practice, I've kept up with that. I dictate after every single patient encounter. So whether or not it's a follow-up or a consultation, I do my note right then and there. And actually, I invite the patient, if they have time, to stay with me. And I turn my screen over to them and I ask them if they want to stay for the dictation. I think that this has a lot of benefits. It helps the patient feel a part of the conversation. I also think that it's helpful for professionalism. I would never say something in my note that I don't say in front of the patient. So it's very hard to say anything non-gracious in front of a patient. I think that that's a big benefit. As well, when I'm seeing patients, I actually don't take any notes because I do my dictation right after. I find that it allows me to focus on the patient rather than looking down at a sheet of paper and trying to take notes so that I can dictate later. I do the dictation right then and there. The other thing that's really helpful actually is that I will sometimes ask the patient for a clarification while I'm doing the note. If there was something that I have another question about, because I'm doing the dictation with the patient there, I can get extra information if necessary. The other thing is the patient will sometimes correct me. If I make a mistake about a family member or their symptoms, they can make a correction right then and there, which I think is great. The last thing is I am a big fan, because I am an outpatient cardiologist. I want to provide great service, not only to the patient, but also to the family doctor. So because I have access to dictation services, I'm able to send my note via a Curo through our fax system immediately. And I would put money on it that actually my notes go to the family doctor before the patient physically leaves my office. And so I think that that's, well, at the very least, it makes me happy. And I hope that it makes family doctors happy. So this is kind of my dictation story. And this is why I am such a big proponent of it. I'm a big fan of working smarter, not necessarily harder. It actually gives me chest pain to think about having to take a stack of charts home to dictate that evening. That would make me feel very anxious. And so I like doing all of my paperwork right then and there. So just a little bit about my dictation history. I obviously have used services at local hospitals and clinics. And I think the truth of the matter is that all of us know that typists are very, very good. A human being listening to a recording who has some background in medical terminology is fantastic. And obviously, dictation services through a hospital and a typist are excellent. They are always accurate. They're wonderful. They're just slow. It takes days or weeks for your notes to be typed. And so that's kind of one of the downsides to the system. I have also used Dragon Dictation. So when I first entered practice, I worked in an outpatient clinic and I used Dragon Dictation. Dragon is a great program. It works well if you've ever used it before. It's very fast. It's fast because it works on your local computer, which means that the computer itself is interpreting your voice, which is different than a lot of the new solutions these days, which are web-based. So Dragon was fast, but it was costly. And when I moved to Saskatchewan, there was no dictation program available for my Mac. Dragon had dropped support for the Mac, and they weren't going to develop it anymore. They were only going to use PCs. So I went with a program called Say It, which is different than Dragon because it is web-based, meaning that my voice is taken and sent off to a server somewhere in the world, interpreted, and then sent back to me. Say It was good. It was accurate, but it was a bit slow. It would take a few seconds for the words to come back to my computer. And the other problem with Say It is that it was very expensive. So if you go out on the market and try to find a web-based dictation service, sometimes it can be a bit slow and sometimes it can be a bit costly. And so when I was contacted by the SMA that they were going to support a new program by Fluency Direct, which is a company of 3M from what I understand, I was very excited. However, I had some concerns because it is web-based. I want my dictation to be immediate because I want to be able to look at my screen while I am dictating. So I have needs, and I have a very, very high bar for my dictation services. It has to be fast. I want to be able to talk fast because when you dictate through a hospital system, you can talk as fast as you like, and the typists are so excellent that they always get it correctly. I can't slow down, and I don't want to be slowed down because it takes too long. I also don't want downtime from a server. I don't want to go to work one day and realize that my program isn't working because I depend on it so much because I do my notes right then and there that it would really upset my workflow. And the last thing, and probably the most important, if we're honest, is that it has to be accurate. The Achilles heel of dictation using a computer is that accuracy is the problem. Typists are perfect, or they're very, very good. And computers have made mistakes. And the problem with clinical practice is that we don't have time to be fixing lots of computer mistakes. And so this is the main question that I had about whether or not this new program and this new piece of software from the SMA would be very good. And I'm just here to tell you, Fluency Direct is great. It's not just good, it's in full production in my office. I am an outpatient full-time cardiologist. I am dictating all day, every day, and it is like phenomenal. And human beings, when interacting with computers, really need a 98 to 99% accuracy. Otherwise, we get frustrated and we give up on the solution. Now, some of the accuracy of this program is dependent on my fatigue, my caffeinated status, and the time of day. And actually, I have realized that I can tell when I'm tired because I slur my words and the computer does not accurately pick up what I'm saying. And it's actually really funny. I can tell when I have not had a cup of coffee. The program is that good. So a couple details about the program that I'd like to tell you about. Firstly, the SMA is covering the cost for the first year of licensing. So the cost of the program is being paid for by the SMA. The hardware is also being covered by the SMA. That means the microphone that you use to dictate into the computer. And the SMA will install the program on every office computer that you have. If you are a family physician, for instance, that uses multiple offices, they will install multiple copies of the software on whatever computer that you use. Now, I should mention that there are some restrictions in the sense that it really should be you dictating, because the machine does have some learning algorithms in it, and it's probably not a good idea to have multiple people using it, because from what I understand, they do a little bit of machine learning on that dictation. In total, if you were to go on the regular market, the cost of that, because I've sourced this on my own, the total cost of that is about $1,500. So that is a very significant benefit. I don't think that's actually the cost to the SMA, but from a private person getting these kinds of services, that's basically the cost. The SMA also has committed to ongoing training and support and IT support, which is lovely. If you want additional microphones, so they're going to give you one microphone, and if you want extra ones for other rooms, it's $338, which from what I understand is the cost of the microphone, so that's lovely. And after year one, the physician will then be responsible for the annual licensing cost in year two, which I'm told is $425 a year. And just to put that in perspective, that is a deal. That is absolutely a benefit. The cost of yearly licensing for a cloud-based or web-based dictation is well over $1,000 a year for whatever service that you use. I've never seen anything less than that. So this is a wonderful deal from the SMA. So a question for you: why should you use dictation in your outpatient practice? Well, I think it comes down to a few things. Increased documentation quality. I think that is a significant benefit from dictation, because you can do your notes as soon as you want. And it also allows you to increase your documentation speed. So if you were able to send your note off or get your note immediately, I think that is a huge benefit. I think documentation is, I mean, I'm a cardiologist, but I'll be honest, the thing that I produce is paper. I produce written opinions, and this is a real tool for me getting my notes and documentation done with accuracy and speed. I think the way that I use dictation, with asking patients to stay, to listen in, and to be a part of the conversation, I think increases patient satisfaction. I also promote the fact to the patient that their letter gets sent to their family doctor right after we're done. So if there is any question from a patient when they go see their family doctor about whether or not I sent the letter to the family doctor so they can follow up, the patient has firsthand knowledge that I did it. And I think, if the family doctor doesn't have it, I hate to tell you, but it wasn't me that didn't get the letter to the family doctor. Someone maybe misplaced it or something. So it allows the patient to have a bit more trust in me. I think it lowers my stress, because I am able to do my work as I go through my day, and I'm able to correct my letters and get everything done immediately. And I think this is going to save significant administrative costs. I mean, I'm not out to ruin the profession of stenography, but to be honest with you, I think that dictation via these web-based programs is so good that it really is ready for prime time. There's been a lot of things sold to us about technology and how they're going to help us. I think that this is a very concrete way of how we can improve our clinical practice through the use of technology, and I'm really happy about this SMA program. So I'm going to stop there for a second. Does anyone have any questions or any clarifications about what I have just presented to you? I do have my EMR open. I have a fake patient. This is not a real patient. We are all, if you live in the Acura world, I'm sure that you are very familiar with our friend Chester Tester. And obviously there is fake data in there as well. So this is not a real patient, and we're going to try to avoid showing any real patient data. Any questions at all? Okay, so I am going to open a clinical note on our fake patient, Tester Chester here. and I'm going to show you the accuracy and quality of this dictation. Okay, get rid of this. Just going to open up my little notes on the side here. Okay, so we'll do this as a slow dictation to start. Today, I had the opportunity to follow up with this pleasant 51-year-old man here in the office, period. As you know, he was initially referred due to difficult to control hypertension, as well as a feeling of tension across his chest, period. When we initially completed his stress test, he had a very hypertensive response to exercise, and we followed up on this with an ambulatory blood pressure monitor, period. His average blood pressure at that point in time was 146/90, period. Okay, so let's have a quick second to review the quality of our dictation here. Okay, I had the opportunity to follow up a 51-year-old man. He was initially referred to difficulty as well as a feeling of tension across his chest. When we initially completed stress, he had a very hypertensive response. Okay, so it missed 2. That's okay. To exercise, and we followed up on this with an ambulatory blood pressure monitor. His average blood pressure at that point in time was 146/90. Excellent. So I'd say we have quite a few words there, and the machine has accurately picked up the age, the clinical information, and the patient's blood pressure, and specifically in the nice format that I would expect a blood pressure to be picked up in a well-functioning dictation service. So that is excellent. Now, let's try something else. Let's go a bit faster with some more complicated words. Again, one of the things that I think is really important is the computer has to keep up with me. I am not here to change how I do things. The computer is expected to keep up with me. And so we're going to do something a little faster here, and hopefully it all works out. It normally does. Since he has been on his medical therapy with Viacorum 14/10 milligrams daily, he has been doing very well, period. His blood pressures at home are excellent and sometimes are in the 110s systolic, period. He feels well on his medication, period. As you know, he discontinued the chlorthalidone because he was feeling lightheaded, and perhaps we overdid it, period. Today, we had a chance to discuss future strategies for reducing his cardiovascular risk, period. New paragraph. I reviewed his most recent cholesterol values, period. His LDL is 2.36, period. Given his diabetic status, he is recommended to have an LDL of less than 2, period. We have discussed starting Crestor 5 milligrams daily, period. He is willing to try this, period. There you go. Okay, so let's check its accuracy here, since he has been on medical therapy. Ooh. Should probably turn off my microphone because it's keep continuing to listen to me. Since he's been on his medical therapy, does anyone notice any errors with that at all? I don't know. That's pretty good. So just to point out a couple things, it picked up the name of Viacorum, which is a really good antihypertensive medication, and it's obviously a brand name. He's been doing very well. His blood pressures are excellent, sometimes in the 110s, systolic. So it's using all the correct words. It's got the use of the acronyms that I expect, and it's got all the numbers as well with the correct decimal point and 3/6. And I see no errors, any significant errors with that whatsoever. So I think that that's really good. Let's show you something else. I'd like to show you a couple extra features that I use with this dictation service, and that is the use of some commands. I'm just going to minimize this here. So the use of a command is sometimes to put in some predetermined text. So a really good example is I always finish my letters with, "Thank you for kindly referring this patient and allowing me to participate in their care." Because I'm seeing a lot of patients throughout the day, I want to have that done for me without me having to say all of it. And this is a common feature of dictation programs and is actually a benefit over having a typist, unless you have pre-negotiated with your typist some sort of situation like this. So we're going to do a bit of a dictation, and I'm going to show you how I put in a physical exam that's normal. As well, he asked me regarding my opinion on vaccines, period. He got his flu vaccine, which I am very supportive of, period. I have also encouraged him to get the COVID-19 vaccine when it is available, period. It is very effective. Period. New paragraph. On examination, the patient's blood pressure was 115/78, period. The heart rate was 82 beats per minute and was regular, period. Exam normal. So just to show you, when I said exam normal, I took this phrase here, peripheral pulses, and carotid upstroke normal, no bruits, precordial exam normal, this whole bit of text there, and I was able to put that entire block inside of there. And you may think that that is a small thing to have available to you, but the truth of the matter is that if you see patient after patient after patient, a few seconds adds up to a lot. And it could be hours or even days of your entire working career that you could be saying, you know, peripheral pulses and carotid upstroke normal, no bruit, precordial exam normal. This could, little things over many years add up to a lot. I obviously don't need to tell you that, but it's a huge benefit. So I think that that is absolutely wonderful. And I use that all the time. And the last thing I'll show you here is that I use the phrase thanks, which is that phrase that I use at the end of my letters. Thanks. And there you go. So I always put that in the end of my letters, and I don't have to say the entire phrase. The other thing that's really important for documentation is that sometimes there's advice that we provide to patients that's very typical that would be very time consuming if it's quite a long phrase. So I have a concern about patients who have chest pain, and I always tell them that they have to go to the emergency department if they have any new or worsening symptoms. So I use a command called caution. So I'm going to use that now. Caution. So it's quite a long phrase, but I like to have it in my documentation and notes. And I don't ever want to feel lazy and not include it because it's very important, but it's quite a long phrase. And it specifically says if they have any new symptoms, they're supposed to go to the emergency department. And so this is a lovely way of creating really excellent documentation that is automated, is appropriate, and can really make a big difference in your documentation. So I'm sure that there are all sorts of things that you can think of in your practice where you would like to have a nice little phrase. Now, of course, Akiro does have some ability to put in a block of text when you put in, specific words, and then you hit Control and Enter, and it can put that in. But I find in the flow of my dictation, I don't want to go back to a keyboard. I want to be able to stick with the voice dictation. And so I find that this has all the features that I really like. So I'm going to hit Close here. There's a few other little features that I'd like to show you. Does anybody have any questions about what I've shown so far? Okay. So I'm going to show you. Let's open up a new letter here.
I just thought of something.
Yes.
So you mentioned that you'd rather do everything with your voice than touch the keyboard, and I noticed you just used your mouse to open a new letter. Is there? Yes. Have you worked with commands as far as that goes?
Yes, I have. Certainly, the dream would be to do absolutely everything with your voice. There are the use of commands to open new letters and things like that via command. I'll show you a very quick example of something that I have built in right now, and it's called task. So if I want to do a new task, I can start my dictation here, task, and it opens task here for me. So I map that to the key F7. I was going to show you that a little bit ahead, but yes, you can map that to any kind of key combination that you would like. So maybe it's billing. I typically will use my mouse when I'm in the billing thing because it's a little bit too complicated to use your voice to make selections about bills and things like that. But certainly there are lots of little workflows that you can build in to your dictation that allow you to open some of these windows or have some key, some predetermined windows open and things like that. So yes, that's certainly an option. I have a few of them built in, but I'll be honest with you, I find the majority, certainly being able to control your computer with your voice might be something that is used in the future, but I am just so enamored with how good the dictation is that I think that the main use of this technology right now for me is to create my letters as opposed to control my computer, although some users would be more aggressive about the use of commands.
Yeah, thank you. That's interesting. Like totally a hands-off approach in some sort of infection control environments would be amazing, I bet.
Oh, sure. Yeah, absolutely. So yeah, that's how you can open tasks, and that's what I've got built into my system. So I'm going to show you something else. There are going to be words that you're going to come across that the machine is going to make a mistake with. Like, I'll give you a good example. There's a new medication that I came across. It's for rheumatoid arthritis. I'm not a rheumatoid doctor. I don't use it all the time, but I have one patient who's on it. So it's called Symphony. So let me try to put that in here. The patient is on a new medication called Symphony. Period. The medication is called Symphony. Yeah, so it's not going to pick it up. It doesn't know about it. But if you are a rheumatologist and you think that that's something important for you, so let's add it to the dictionary. It's very easy. I'll show you how to do that right now. So there's this little sidebar thing. That's the M modal running in the background here. We're going to go to dictionary. And there's all sorts of different things that you can add to your dictionary for the machine to pick up. So there's person names, there's locations. So let's do medications. I've got some of my cardiology specific ones here. It didn't know about Lixiana or Repatha. So let's add Symphony. So it's called, so I just add on the top right there, I clicked add, and I'm going to call it Symphony. And I think that's the trade name of the drug. Now, it has picked up that it thinks this is the way it's said. And actually, that's pretty good. And I think if I hit save right now, the machine would correctly pick up Symphony. But let's say, for instance, it's a bit of a weirder word that you don't think it's picked up phonetically just by writing it very well. So let's hit change. And we're going to do record the pronunciation. Symphony. Okay, so that's the way that it picked up my voice when I did that, and I'm going to hit OK. Excellent. So Symphony, it's phonetically written it out as Symphony when I said that, and now I'm going to hit save. And now you can see that it got added to my list somewhere in here. There it is right there, Symphony. I'll hit close. And the system is really, really fast. Some systems are a bit slow. It takes it a while for it to learn it into the system, like it has to incorporate it into a database or something. But this works pretty quick. The patient for her rheumatoid arthritis is on a new medication called Symphony. Excellent. So there are times when I think it's worth it to teach the computer new things, and sometimes I think it's not worth it. That's why Symphony is not in there. But there are lots of situations where maybe I have a way of saying a word that I prefer and I want the computer to pick that up. You can teach it all of those things. And I've just shown you that it picked it up very nicely. Okay, so I'm going to go back to the dashboard here. I'm just going to go into the commands section. These are the word commands that I was telling you about earlier to insert a block of text. Or you can tell it to do other things. So let's go to the task one that I showed you earlier. The name is called task, and I have told it to simulate pressing F7 when I say the word task. But there are other things you can do. You can get it to move windows. You can get it to do certain mouse actions. You can get it to wait. You can get it to press certain key combinations. There are lots of things that you can teach the computer how to do. I have not incorporated a lot of those things, but those are things that you can do. And it is a very powerful feature of M-Modal. And I actually think, you might think, oh, the SMA, maybe they have access to, a dictation system that's just okay. I don't think this is just okay. This is fantastic. This is top of the line dictation services for physicians, end of story. I haven't found anything that's as accurate, as fast, or as full featured as this program. I am very, very happy with the program. And I have no relation to this company whatsoever, just as an FYI. You'd think I do, but I do not. Okay. Now, the last thing I want to show you is sometimes the machine will put in words that I never want it to recognize. So let's go to that right now. So you can do excluded, words you never want included. It had a tendency of putting in pickle. Sometimes it would curse. And sometimes it would pick up American versions of medications. Chantix is the trade name of Champix in the United States, and it put in Chantix all the time. It was driving me crazy. Sometimes I would say like symptomatic Lee, and it would pick up Lee or Leah, or like I would put an ing at the end of something and it would pick up ing. And those are words that I never want it to pick up because I don't use them. It would misspell Chads all the time. I don't want it to pick up Chad. I've got it actually inside of the dictionary to be Chads 2 score. So I do a couple things like that, just some things that were kind of annoying me. I don't use the word Pacific very often. And like I said, you can kind of categorize some of these things. I've got some local towns, Shaunavon and Wigmore Hospital, and a couple nice features like this that I wanted the machine to detect that it probably wouldn't know much about because it's a fairly generic system. Okay, the last thing that I'm going to show you, just for fun, is some of the funny but infrequent errors, which again occur at the end of the day when I've had no coffee or I'm feeling tired. And maybe you'll find, so whenever I find a funny word that it messes up, I don't think it changes the meaning of my letters. I think a family doctor, in my opinion, would rather have a letter same day rather than a perfect letter. So sometimes there's just some silly words that it puts in that if you phonetically work it out, you kind of know what a person's saying. The system's not perfect. I mean, a human being's not perfect either, but here are a couple funny ones that I thought was good. Okay, so I said, I had a chance to review, and it said I had a rich chance to review his most recent blood work. Hemoglobin A1C was 9.1%. I actually take pictures of my screen and I send it to another friend cardiologist of mine, and he kind of gets a kick out of it ever so often because he uses dictation as well. Okay, here's another one. There's a thing called an Agatston score. An Agatston score is the calcium buildup on a coronary angiogram or a screening CT coronary angiogram, and it's called an Agatston score. And it said the patient had an elevated maggots in score. So I taught it about Agatston, which is the scoring system. So elevated maggots in score. And this is the best one. I'll just hide it from you right now. There is a very specific diagnosis. I think it's an autoimmune inflammatory condition called Takayasu's. And Takayasu's can cause stenosis of some of the larger blood vessels. And I had a patient who had a dilated aorta, and they suspected that she had Takayasu's. And so it put in there, I had a suspicion about potentially Takayasu's arteritis. So I caught that before it went out to the family doctor. And so that was very helpful. You got to pay attention to the machine. I read through my letters before I send them out, but I would say, again, 98, 99% of the time, the dictation system that the SMA has promoted has done a lovely job. So I've got a couple takeaways for you today. I think physicians should always consider ways in which they can work smarter, not harder. And I am acutely aware of my position as an outpatient cardiologist in that I want to provide great service. And I think dictation services allows me to work smarter and provide great service to family doctors, specifically same-day letters and including patients in the documentation process. I think physicians should consider including dictation at the point of care in their practice for this reason. And the SMA has really funded a wonderful program with Fluency Direct. And I think Fluency is good enough to replace a typist. When you have 98% accuracy with instantaneous results so that you don't have to review a letter later on or anything like that, I think that this is ready for prime time. And so that is the end of the presentation. I'm happy to answer any questions for anybody. If there's anything that I can answer for you, or if you have any questions, please let me know. Thank you very much, and thank you for the opportunity, and thank you to the SMA for this excellent program.
Thank you, Dr. Wilkinson. That was great. Does anybody have any questions?
I don't know if it's so much of a question, but I really appreciate you sharing how you work it into your practice. I'm a practice advisor with the EMR program, and that's the piece sometimes that we're not able to sort of give people ideas about. You know, we can show you how to use the technology, but how you say that you share your screen with the patient and go over it, I think that's something that we could promote as well as a way to use Fluency Direct and even just documentation in general.
Yeah, I think it takes a bit of a shift of the mind. Physicians have a way of working that is very natural to them, and they've been doing things for a long time in that way. And I think being able to do your paperwork immediately with the patient there, I love it. I mean, I wouldn't do it any other way. I would love for more people to use dictation in their practice, because documentation is a fundamental component of professionalism, and it can make a big difference for your stress. The idea of having to go home with a big stack of paperwork and finishing it later, I mean, there are limits to clinical practice and people are very busy, and I understand that, but being able to do the dictation right then and there, I mean, I think it's life-changing. For me, it's really important.
Did it change the length of time you need for an appointment? Do you build that into your appointment, or?
It is, yeah. So I would see patients at a slightly slower pace, which is where the time is coming from. But consider I think when I look back on it, there's actually some inefficiencies in the system if you were to dictate to a typist and then have the letter sent back to you and then give it back to somebody else to then fax out. That takes a lot of time. So what I'm doing is I'm doing my paperwork and I am reviewing it right then and there, which cuts out not the middlemen, but all the other processes along the line. And for my practice, I'm saving my time, I believe, by lengthening I'm lengthening my appointment time by a little bit, but I think it's worth it because you're actually saving a lot of time down the pipeline. And like I said, I'm a big fan of trying to make my patients as happy as possible. And it's a bit unintuitive to maybe dictate with the patient there, but I love it. I think it's the best, and they like it. End of story. I've got great feedback. I have never had anybody say, like, that was unusual. I don't want to be a part of that. If they have to go, if they're busy, no problem. Like, we'll book your appointment. We'll see you later. But my experience is 95% of people like staying. Oh, the other thing I should mention is when you dictate with the patient there, they get a second go at the information that I just told them. And I think as a specialist, this is just something that's for me, is I think as a specialist, FaceTime with my patient is really, really important, which means if I can spend more time with them, they're happier. And I think that that's a huge benefit. If I can give a patient more time, why would I dictate at home in a dimly lit room by myself when I can do it with the patient so that they know their paperwork's being done, they hear everything a second time, and they have an opportunity to ask more questions. It takes, yes, maybe another 5 minutes, but the truth of the matter is they get to mull some things over in their mind about things that I've said. They can ask for clarifications. I don't know. This is how I work. I'll stop talking, but I really like it.
No, that's great. That's yeah, that's an interesting way. I've never had a physician do that, but I think that would be very, and not only that you get to hear it the second time, you actually get to see it.
Yes.
I think, different people are visual learners, or they're, I can see that definitely being reinforcing for whatever you're trying to get them to understand.
I just feel like there's a bit of a curtain between me and the patient when it comes to documentation. It's like, okay, patient, now it's time for me to go away and like do my paperwork, and I'm gonna say whatever I want about you, and which is true. Like, you don't know what the person's gonna say, but I turn my screen to the patient. They can watch my dictation happen, and they can make any clarifications or changes if they need, or if they're not comfortable with something that I put in the letter. Like, this is a collaborative program, collaborative process. And maybe it's because I'm newer. I don't know. Maybe I'm up for collaboration. You're a part of your care. It comes down to a philosophy of you are a part of your care. Dictation is important to me because it allows us to collaborate. And this is the most concrete way that I know of to collaborate with my patient. And the SMA has allowed me to do this with a good tool. So, it's a big deal, in my opinion. That's why they got me to do the talk.
Yeah, thank you for sharing.
Yeah.
Does anyone else have questions? Actually, I'm curious if your entire practice is using Fluency Direct all the time at this point.
So it's a one cardiologist office. So yes, our whole offices use it because I'm the only one here. We have a nurse who is who's going to be helping us with some pre-assessments for patients. And I have requested from the SMA another license for her, because she's going to be doing some documentation, and the idea of making her type out on a keyboard, I mean, it works for me. Why can't we get her a program as well? And like I said, the price is right. I mean, $400, in my opinion, for an extra user, I'll pay that every day, all day. It's going to help her. It's going to be lovely. Yeah. Yeah. Oh, I think we got a question on the chat there. I'm not, someone asked whether or not I use it for papers or emails. That's a really good question. I have not at the moment. I'll be honest, I don't write a lot of emails because I'm a predominantly outpatient cardiologist, and when I'm kind of doing emails, I don't. But I could see a person using it as a pre-draft for anything. It's the verbiage, like the dictionary that it has, is really meant for like you can be set up for a different specialty. So you can be pre-set up for family medicine or gastroenterology. So my world is cardiology. So if I was doing research papers in cardiology, I think it would be pretty good. I think it works great. You totally can. There's no reason why you can't. You can dictate into anything you want. You can have like a note open in a totally different program. It's pretty generic. You could dictate into Microsoft Word if you wanted. This is not EMR. That's a really good question. This is not EMR specific, meaning it's not directly tied to Accuro. You could easily have any other program open because it's just running here on the side, and you could just open up whatever you wanted and dictate into it.
Yeah, we had a session yesterday with Dr. Coben talking about Fluency Direct and MedAccess, and he actually did a little demonstration of how he uses it to write in programs that are not related to his EMR. So yeah, it's a good tool that way.
Absolutely. Yeah, it's good.
Dr. Wilkinson, thank you so much for the presentation. It was really awesome. And
Okay.
to hear how you're utilizing the system to improve the patient care in the end, right? Trying to provide patient-centered care. So I'm wondering, then because you're using dictation system all the time, do you mostly use free text and notes, or do you have a certain template they use with the dictation system in the EMR?
Because Accuro has a lot of the baseline data, so when I create a letter, it will put in all their medical information. I don't use a lot of templates because as a cardiologist, I guess I could be, and I could be skipping around a little bit. So I could be inserting pieces of information. There are certain specialties that would work really well for that style of practice. If you have like procedural related specialties is an excellent example. So if you were doing, I don't know, colonoscopies or something, and you had a very specific set of things that needed to be in there, it would be very easy to drop into a template in Accuro and then just skip around. So yeah, that's different than my practices, but certainly if you were in a procedural specialty, you could have a template open and you could skip around and dictate into that. And that's a great idea.
Yeah, good to know.
There was another question in the chat. The question is the SMA discount indefinite or a limited time offer? So basically, the subsidy for Fluency Direct is for the first year, and I think that we're just going to extend that indefinitely. We don't have any cutoff date for when you can stop getting that for the first year that you're signed up.
And then the cost yearly after that is, I've been told, is $425 a year, and it sounds like there's no plans to change that, Andrew?
Plans to change that, as far as I know, no.
Yep. So it's really competitive. Like really competitive. It's great.
Are there any other questions? If not, I just want to thank you. I think this is a really good session. It was really informative for me, I can tell you. Yeah, thanks a lot for your time. I know you did this on your lunch break. And thanks a lot, everybody, for showing up. And we'll talk to you later.
Thank you for inviting me.
Thank you.
Well, great seeing you again.